is Alice Lichtenstein. I am the chair of the writing group of the American Heart Association 2026 Diet and Cardiovascular Health Statement. About every 5 years, the American Heart Association reassesses the available data on diet and cardiovascular health, given it's really such a dynamic field and there's a lot that goes on at any one time. This statement is an update of the 2021 diet statement.
Thank you, Dr. Lichtenstein, and I'm Amit Khera. I'm the vice chair of the writing committee, and very fortunate to be so. I wanted to talk about some overarching concepts before Dr. Lichtenstein goes into some detailed features. A few overarching concepts about diet for cardiovascular health. The first is really about an overall pattern. Rather than a focus on individual macronutrients, really the emphasis should be on healthy pattern. There are many have been published by AHA and others that related Mediterranean, DASH, others, but there's many that one could look at that have healthy patterns. The second important thing is the life course. We really have to remind ourselves that cardiovascular disease begins in childhood and we transmit our habits over generations. And so we really need to be looking at these healthy patterns, not just later in life, but throughout the life course, starting in childhood and then throughout, and that we do transmit these habits onwards. And so to make sure we're handing off healthy habits to our children and others. And the final thing is realizing that although we're thinking about patterns individually, maybe in our homes, but these guidance that we provide really applies everywhere in our workplaces, if we look at schools, and it really has policy implications as well.
Thank you for setting the stage, Dr. Khera. There are some important key messages that we have organized into 9 features. The first is to adjust energy intake to achieve and maintain a healthy body weight. This is something that's very fundamental and basic, but very important. And hopefully, with the more of the stress now on introducing heart healthy dietary patterns early in life, the emphasis will be more on maintain than having to first achieve. The second feature is to include plenty of vegetables and fruits into the diet and choose a wide variety. And there are a couple of points here. The first is if you have a dietary pattern that's rich in vegetables and fruits, then there's going to be less room for other things that maybe we should be eating less of. The second point is why a wide variety? Well, by consuming a wide variety, one ensures that they have an adequate nutrient intake. And there's so many healthy ways to prepare vegetables, particularly vegetables, but also fruits, vegetables, one of which is roasting in terms of the vegetables. But also there's so many different healthy ways of getting vegetables and fruits. So obviously one is fresh, but it's important to emphasize that frozen is an extremely high quality. It's very affordable and it's available. They're just all you have to do is then open up a bag and pour some out, regardless of whether you're doing a stir fry or you're making soup or a stew, and there's virtually no waste. The third feature is to choose foods made mostly with whole grains rather than the refined grains. And this has become more and more easy because of the major categories of grain products. Almost all of them now are available in a whole grain version. And this, I'm referring to things like bread and crackers, pasta, brown rice. One needs to use a little bit of discretion, but in general, for the more basic food components, we have comparable items that are whole grain. The fourth feature is to choose healthy sources of protein. And there are a number of different ways to do it. One is to shift away from animal sources towards vegetable plant sources. So those would be things like legumes, nuts. And it's easier to do that now because we have a lot of canned beans. Fortunately, we have the reduced sodium versions of them that can just be drained and added to a whole variety of foods or salads. Another way to choose healthy sources of protein is to regularly include fish into the diet, so fish and seafood. One advantage is you've got the omega-3 fatty acids, but the other advantage is you're probably then not going to be eating something like steak or quiche that is going to be high in saturated fat. Select low and non-fat dairy products instead of full-fat dairy products, again, because of the healthier profile of protein to fat, whereas low and non-fat dairy products are excellent sources of high quality protein and also nutrients of public health concern that we may not be getting enough of, things like calcium and vitamin D. And then if red meat is desired, choose lean cuts, avoid processed forms, and really think about portion size or frequency. Feature 5 focuses on fat, and the recommendation is to replace sources of saturated fat with sources of unsaturated fat. So what do I mean? It's mean using plant oils, the unmodified oils, things like soybean oil, olive oil, in place of animal fats that would come from the full fat dairy, or they would come from the meat, or things like butter. The sixth feature is to choose minimally processed foods instead of ultra processed foods. What do we mean by minimally processed foods? Well, there are a lot of definitions for that, but in general, if the food resembles what it originally started to look like, then it's probably minimally processed. Now, why is this important? Well, it's important because processed foods tend to be higher in added sugar and salt than the natural forms. And in some cases, they have other things that are added that sort of dilute the nutrient quality of it. So, in general, focus on minimally processed foods as opposed to ultra processed foods. The seventh feature is to minimize the intake of added sugar in beverages and foods. This is not something that's new, but is still important because we are consuming more added sugar than is really good for us. How to do this? Well, now there are a number of foods that are relatively high in sugar, but are now coming out in reduced sugar varieties. And also, it's really minimizing the intake of liquid sugar. So that would be beverages, sugar sweetened beverages, sugar sweetened tea, soda, all those kinds of things. The eighth feature is choose foods low in sodium and prepare foods with minimal or no salt. The intake of sodium, salt, is associated with blood pressure. We know that by reducing sodium intake in most individuals, blood pressure will come down. A lot of the foods that we consume, again, particularly processed foods, are high in sodium. One way of determining how much sodium is in a product is to look at the nutrient facts label. That sodium is actually listed. And if you're trying to reduce sodium intake, let's say you're looking within a category, bread, just compare a couple of them and see which one's lower. Crackers. There's a lot of different ways that you can do it. And the ninth feature is if alcohol is not consumed, do not start, particularly to improve heart health. And if alcohol is consumed, limit intake. We know that high levels of alcohol intake have very adverse effects, but even moderate intakes of alcohol certainly are not cardioprotective and may have adverse effects. So that sums up the 9 features of the 2026 American Heart Association statement on diet and cardiometabolic health.
I think there's some key messages that we've really wanted to highlight here. The first, going back to the patterns, that if people follow these patterns, if they follow all these 9 features, you will have followed all the major guidance for nutrients and achieving all the numbers that we encourage people to achieve across their diets. The other thing is that we'll have foods that are richer in fiber, so that will automatically be part of it. When we think about limiting cholesterol, that also would follow in terms of achieving our numbers that we're thinking about. And importantly, when we look at other diseases, chronic diseases like type 2 diabetes, cancer, cognitive changes, these patterns also have a relationship with those in terms of improving those and avoiding the development of those issues as well. These patterns can also be adapted. We think about this guidance and features for individual what individuals like to eat, individual preference and cultural preferences, and they also can be started early in life. Back to the life course, we hope to introduce very early in life so that people learn these patterns and habits throughout the life course to maintain their cardiovascular health. So it comes down to following this guidance, and if you do so, the rest is pretty simple. You'll have met all of the major requirements for a heart healthy and overall an overall healthy diet.
This statement represents the work of a large group of individuals, including the members of the writing group and also the American Heart Association staff. So I think I can say for both of us that we're immensely grateful to everyone that has contributed.
Well, thank you. And this is out online now. And so we really want each of you to read it, strongly encourage you to share it with your peers, share it with other researchers, clinicians, and share this information with your patients. Ultimately, this is about improving health, and we really need everyone's efforts in terms of disseminating and implementing it.